It is 12:04 right here. Dr. Payne Show, 1-855-55 Dr. Lou, DRLOU, or info@paincarecanada.com. That is anytime, but right now, if you want to call in, have questions, have health concerns, bring them on. 416-870-6400, star 640 on your cell phone. We're here till 1 o'clock, man.
What if
questions.
someone wants to call from a landline?
That's fine.
They're not allowed?
No.
Only from cell
not.
phones. We're
That's
only
right.
accepting those calls today.
Yeah. Do you still have a landline?
Yeah, actually.
You do? Wow, you're old school, dude.
No, it was because actually I was talking about this yesterday. It was cheaper when we got the internet and
they still try to
TV and
bundle
stuff.
it?
Yeah, it was cheaper to get it bundled with a landline.
Yeah.
Otherwise, it was actually more expensive. So I was like, okay. And all I do is get like junk phone calls on that landline. So
Why do they still push their landlines?
I have no idea.
2017. You know, it's cheaper. I don't care. I don't want it. It's cheaper, sir. I don't care. I'll pay the $5 a month not to have it. All right?
Yeah, exactly.
So what's going on? You were ranting in the hallway about some stuff, some changes happening.
Well, there's some, I guess, obviously we try not to make this show overly political, but I do think with some of the things that are happening in the auto insurance industry, and I work closely with these things both on the plaintiff side when people are hurt and also on the other side with the insurers, I do think it's important that or not important, but at least I wanted to voice my opinion about these things because I think they're being a little mischaracterized in the media. There were a couple of articles in the Globe and Mail this past week about what's called an IME, which stands for an independent medical assessment, or examination. So sometimes what will happen is if you're hurt in a car accident, specifically in this type of case, you'll be sent for these independent assessments where you see a doctor hired on by the insurer, or it could be hired on by the lawyer, depending on which side is asking you to go to that IME. And anyways, there were some articles basically characterizing how bad these doctors working for the insurance companies are and how it's this big evil scam and they're just making all kinds of money. And, there's bad in every profession,
sure.
right? And there are some people doing some bad work on the IME side for sure. But the vast majority, I can tell you, I work in this industry as well. I'm both, again, the plaintiff and the defense side. I can tell you that the vast majority, like 99% of the people that I work with, or everyone I work with, but even the names that I've seen, and I see a lot of these files, these are just good people doing what they're supposed to be doing. These are, for them to say in some of these articles, they were essentially saying that they never see the patient. All this stuff, it's not true. Like the doctors that I work with, they see the patient, they review the full medical file, they do an examination, and they just give their opinion. And one thing that this article did not bring up is how much fraud there may very well be fraud on the insurance side. Absolutely. I'm not saying that that's impossible. But what these articles are not bringing up is how much fraud exists on the other side, on the side of either on the plaintiff in terms of people lying about the extent of their injuries, and maybe the personal injury lawyers making them worse than they really are. And so those things, there's fraud happening on both sides. And there's plenty of articles that and cases where there's access that anyone, the general public, can go to and look at, where judges have essentially dismissed these things because they've essentially said, like, there was so much opportunity for you to do the things that you wanted to do and you just kept delaying it. And so that's where all of these fees, and I guess when you really look at this, in a sense, the auto industry in Ontario is somewhat broken because of the rates that we pay. And we pay these high rates because of what's happening in this auto industry where you have, fraud on one side, fraud on the other side. And so it affects everyone. And, there's some proposed, the Ontario Liberals have just proposed going ahead with some recommendations from what was called the Marshall Report on the auto insurance industry. And again, some of those changes I think would probably help. And I also think there's some changes in there that they're proposing that are not going to do anything. In fact, they'll probably make the system overall worse. So I think this is too much of a political play in the sense, like, let's try to do something in an election year. I think the auto industry does need reform because, again, we all know how much we pay for our car insurance and how expensive it is here in Ontario. But I do think that this is something that needs to be done appropriately. It needs to be calculated and it needs to be implemented in the right way through proper channels. And they just need to do more research on this. Like, how do we actually fix it? Because in 2010, there were changes that came into play with what's now called the minor injury guideline. And that was supposed to fix the system. And it didn't. We're still in the same place. Our auto insurance is still as high as it's ever been. Have you noticed a drop in the last 10 years?
No, sir.
Exactly. So, and these were all things where it was like this old system was so broken that we were paying all this money. And so let's do something new and that'll solve all the problems. And that's what we've got right now. It's just a play on anytime things seem somewhat broken, you try to put a Band-Aid on it. But I don't think these things need a Band-Aid. I think at this point, what needs to happen is it needs to be completely reviewed, not by just one person or one panel, but by multiple different entities to figure out what is the best way of going about this. And, it was funny with the Marshall report that came out about the auto insurance industry. There were some things there about, how the auto insurance works. The person who did that report used to work for WSIB, and WSIB has the same problems. Like, if you're going to sit there and say that WSIB assesses people the right way and that there's no fraud happening on that end, it's absolutely wrong. So again, I think there needs to be impartial people that are hired to look at this. But that's my little rant on the auto insurance industry.
Your phone calls 416-870-6400 star 640 on cell. We're going to get into injuries and the stuff that all that winter weather brings after a short break here. It's the Dr. Payne Show, Global News Radio, 640 Toronto. It is 12:12 Saturday afternoon. Yeah, give us a call. We got lots of room to get you in. Ask your pain, your health questions to Dr. Lou. Here to answer them right till 1 o'clock today. Jeff, good afternoon. How are you, pal?
Good afternoon. Not too bad, guys. Just a couple of quick questions. My situation is I have chronic liver disease, and I also have cirrhosis, and I've lost about 25 to 30% of my liver. So I am currently working full time, but I'm having a very difficult time working the full-time hours, but the employer is not providing any flexibility at all. So I do have a long-term disability insurance plan, through work. So I was thinking of applying for LTD, but last time I did, they said I had to go see one of their doctors, and at the time I didn't want to disclose my condition, my health condition. So I'm just curious, through your experience, in general, are the employers' physicians, are they there just to deny claims, to look at you in any way possible that will give them an out so that they don't have to provide the claim?
Yeah. So what I can tell you first and foremost, obviously I'm not a lawyer that deals with long-term disability insurance, and I do think this is a good question probably for Sivan, right? So contacting Sivan Tamarkin, who also has the personal injury hour, I believe on Sundays and a couple times throughout, I believe even Saturday evenings. He would be a good person to really talk to if you're interested about the legal ramifications of how you go about this, how you do it the right way, and he can definitely help you with that. In terms of just your last question, are the doctors there to deny? No. Insurance companies hire other companies to find assessors to assess these things. Every physician's job, every doctor's job, anyone that's a healthcare professional, first and foremost, they've sworn to be ethical and to do the right thing for patients. And so can I promise you that every single doctor that works on the insurance side or whatever side is 100% ethical and only does the right thing? No, I can't promise you that. What I can tell you is that all of the healthcare professionals that I know always try to do what's best for the patient. And if someone truly has an issue, then they just give their medical opinion. And the reality is these assessments, whether it's for something like this, a long-term disability or a car accident or WSIB, all they really are is a way to police the system. Otherwise, people would just abuse the system and take advantage of it. And so, there needs to be a body, an organization, and that's what these IMEs are, that essentially police the industry and give their opinion about a person. And if you truly have a problem and it's truly affecting your ability to work, then I can't see why anybody would make it their mission to want to deny you. If they, that, so the simple answer here is no, it's not some conspiracy where, we're all huddled in a room and all we're looking for is a way to deny people.
Yes.
We do what's right. The reality is there's a lot of fraud that happens. A lot of people lie about their problems, sure. and it's our job as healthcare professionals doing these independent exams to essentially try to understand if someone is telling you something that makes sense or doesn't make sense. Exactly. And we're trying to essentially find who are the ones that truly need it and who are the ones that don't need it. Is that system perfect? No, not necessarily. Do other things get in the way of making the appropriate diagnosis? Sometimes, absolutely. But that's where something like this, where you teaming up with a personal injury lawyer, and I would recommend Sivan for sure for that, is the best way to go about that. And John, you do that show, so Sivan's number.
Yeah, we'll set Jeff. Jeff, we'll keep your number. We'll get you that contact. Jeff, as far as your workplace is concerned, have you medical documentation?
Yes.
And you've shown it to them?
No, I'm in the process of filling out all the forms. It's quite, it's like filling out the forms as if I'm going to Mars or something.
Yeah.
It's quite the complicated.
But you said your workplace wouldn't budge, or is that what you said?
Well, previously I was denied LTD, but that was because I was unwilling to give up my confidentiality. I didn't want to tell them that I had liver disease. Tell my employer.
They're allowed to know prognosis, not diagnosis. You don't have to tell them what's wrong with you.
Yeah, they only need to know your
legally can't ask you that. Yeah, they can say when you're going to come back. They don't have to ask what's wrong with you.
Yeah.
So this doctor, though, that the employer asked me to go to, wouldn't he be looking for a diagnosis?
Because he's a doctor. He's not your employer,
he's a doctor. Right? He would have to review the medical file. Absolutely. Yeah, there'd be no way for him. Imagine that doctor was me. There would be no way for me to make a recommendation on your overall case if I don't know everything about your case. So you don't have to, just because the doctor who's being hired by the insurance company knows the diagnosis doesn't mean that the employer is going to end up knowing the diagnosis. Right. That's still, for me, it's confidential. I'm just providing my opinion. It's not the employer, right? It's the insurer. So I'm providing my opinion back to the insurer, and the insurer does not have to tell the employer what your diagnosis is. An employer is only allowed to know your limitations and your prognosis, as John said.
Not diagnosis.
And even, that's something that Lior would talk about a lot for sure. I'd say start by giving Sivan a call, and he can point you in the right direction, because him and Lior also work together. So if there's an employment issue, then there you go.
Yeah, I got your number, Jeff. I'll get you those two numbers for Lior and Sivan as well. Again, that's the thing, though. That's why I asked about his employer. It's a duty to accommodate. They have to accommodate.
Yeah, for sure. Condition. Yeah.
There's like 3 different shows coming here at once.
Lior and Sivan owe me right now.
They got it. Anyway, back to the Dr. Payne Show.
Exactly.
416-870-6400 *640 on your cell. Lots more coming up. It is the actual Dr. Payne Show right here on Global News Radio 640 Toronto. It is 12:21. Dr. Payne Show, 416-870-6400 *640 on your cell. You've got pain. You have questions, health questions, issues. Bring them on. Dr. Lou here to answer them up until 1 o'clock this afternoon. It is soon going to be time, and by soon I mean Monday, with potentially 4 to 10 centimeters of snow, that it's going to be slip and fall season back here. There's going to be ankles, there's going to be hips, there's going to be necks, there's going to be all kinds of stuff.
Anything.
Coming
all the
through
way
your clinic,
head
right?
to toe. You could start, for sure. You could start at the head. You might slip, fall, have a concussion.
Right.
You can injure your spine somewhere. You can injure an extremity. You're falling. You stretch your arm out to stop your fall. You might hurt your elbow, your wrist. You might hurt your hip, as you said, your knee, your foot. Anything is really
tailbone
possible.
Action.
Yeah, it's really, all of it is possible. Actually, and in bringing up this issue, there was a sad case that I heard through one of my colleagues at work where a young girl was not involved in a slip and fall, but was involved in a car accident. I guess she had a little bit of a trauma to her head when it happened. She ended up passing away because, she probably had some type of issue going on, some type of hemorrhage. I don't know the extent of the details, but I do know that she hit her head. She had a headache, and then all of a sudden, she ended up passing away. And so it's very, very important. My point on why I'm bringing this up is after you have a slip and fall or some type of trauma, it's very, very important to get checked out. Now, most people will think, oh, I got to go to the hospital. I have to go to the hospital. That's not necessarily true. There's a lot of tests that I can do in my office simply by seeing me or want somebody in my team, that you can do a quick scan of the neurological system to see if there's anything there. And then if we pick something up, we could say, okay, now you got to go to Emerge. And that would actually expedite you, right? Versus you just being triaged in Emerge. If you've already had someone, a healthcare professional, who's looked at you and said, hey, there might be a potential brain bleed here or something going on, you'll be expedited when you're at Emerge.
Smart. That's smart thinking.
Yeah. So there is a better way to go about it. Now, obviously, if you're unconscious or whatever, the ambulance is just going to take you to Emerge because they've already triaged that. But a lot of quick fender benders, what will happen is the person will just say, yeah, no, I feel fine. Just go get checked out. Yep. It's very, very simple. And again, don't think, oh, I got to go to a hospital to get checked out. If you're listening, just give us a call. Give me and my team a call. We're open 7 days a week. Someone will be able to check you out. It's you just go in, you get checked out. If everything's good, you're good. You're sent on your way. If you're not, then you'll be sent to the right people. But it's nothing to take lightly. And the other thing too is in a lot of these things, let's take, since we're doing the personal injury show right now, let's take into consideration you're in a slip and fall and you fall and you don't go seek attention right away, and there's eventually a claim. I'm sure Sivan would say that the sooner you get this type of stuff started, the better, because there's quicker documentation. Things are being put down.
Take pictures, all that stuff.
Exactly, and it's very, very important that you do that. But focusing on the health the health side of things, it's also important to get assessed right away because your prognosis is better when you catch things early. And a lot of times, I see a lot of people who are involved in pretty severe car accidents or slip and falls. And, for the first week or 2 weeks, they're not feeling that horrible, right? And then all of a sudden, once the body starts to calm down and things start to set in, boom, everything's there. In fact, there's some cases where people don't feel worse till years and years later. And, when you just look at this from a purely physics perspective, when you look at the transfer of energy when you're dealing with something like a car accident, the amount of mass in that vehicle, the speed that it's going at, and it's being transferred into human tissue, that, there's going to be ramifications. Although you may not feel them right away, there will be issues that develop. And the same thing is with slip and falls, depending on how bad it is. You slip off and you go down a couple sets of stairs. That's nothing to, to write off. That's it's a serious injury. And again, depending, do you have other things going on that diminish your prognosis? Like, are you somebody that already has other types of diseases that may affect your recovery time? What's your age? How healthy are you? All of these things are going to determine prognosis. And so it's always best to get checked out right away. And, it's usually not the people that have those issues that don't get checked. It's the people who just think themselves to be absolutely healthy. Say, no, I just fell. It's not that big of a deal. It can lead to the other issues. Just go get checked out. It's really, really important.
You must lose count of how many people are like, I thought it was okay. I was in a car accident or whatever 2 weeks ago. I was fine. Now I can barely walk. My knee's killing me.
Oh, yeah, it happens all the time. And can I tell you exactly why it happens? I think a component of it is adrenaline. In the initial stage, your body's just amped up, and that may have some type of half-life that ends up lasting longer than just 24 hours. The other thing is, some things just end up rearing their heads a little bit later. But you're right. I see it all the time of people who come in and it's very rarely, hey, I was in a car accident today or yesterday and I'm in all kinds of pain. Because usually if they're that bad, they've gone to the Emerge, right? And they're probably on a heavy dosage of medication just to help calm it down. But for the more regular fender bender types of things, you're right. It does tend to be weeks later that someone's coming in and saying, I got into this car accident a couple weeks ago. It wasn't anything major. I was feeling fine. But, the last few days, my knee is off. My back is off. Just doesn't feel right. And that's absolutely possible and likely a result of that car accident or that slip and fall, whatever it may be.
I mean, knowing working with you and Savannah and everybody, I know so much more now. But I've done it when I was young. Take a header on wet stairs on the TTC going down the subway. You feel like a d-bag. You don't want to stop. It's the embarrassment that gets you up and gets you out of there. Like, I'll deal with it later.
Yeah, exactly.
And then 2 days later, you're like, oh man, I should have told somebody.
Yeah.
But you feel like an idiot.
Yeah, for sure.
Right?
Well, a good example too is when you look at people, if anyone that's worked out, when you lift weights, do you feel pain because of that right away? No, it's usually 24 to 48 hours later because it takes time.
Except you want that pain.
Yeah, you want exactly. You want that pain, but just to show that injury, because that's really what working out is. It's controlled micro trauma of a muscle, but injury does take time for you to actually feel it. It's not something that you necessarily will feel in that minute or an hour later. It can take 24 to 48 hours after the injury, and in something serious like a car accident, it could potentially be even longer.
Having said that, I mean, this time of year coming up where there's going to be a lot of slip and falls, would you recommend, depending on where or what somebody's injured, you would say, you know what, this requires faster attention? If it's head, if it's neck, is that more of an emergency, more of a red flag than, say, a hip or a knee?
Well, again, going back to, when you look at the potential consequences, you should always, as a healthcare professional, always think, what's the worst case scenario here, right? So there's some things, obviously the head, right? You injure your head, you're not feeling right, you got to get that checked out because you don't know. You might think it's a concussion, but a brain hemorrhage can almost present the same way as a concussion. And a concussion is there's no actual trauma that you're going to be able to detect like on an MRI versus inside. Hemorrhaging is your brain is bleeding. That's a very, very serious thing. And if you don't get that controlled, that's potentially fatal. Then you think about maybe an older person who slips and falls, has a history of osteoporosis and hits their hip. That's potentially life-threatening too, right? You want to make sure there's no fracture in that hip or in that sacrum, the pelvis, etc. So yes, some injuries I think need more serious attention. Spine-related stuff, you never know. Did you fracture something? There's a lot of people who have serious spinal fractures.
And don't know it. It's
not necessarily that they can't move around, but they're just one wrong step away from that fracture potentially causing them to be paralyzed.
Wow.
So yeah, if you have, what I call that when you look at skull and spine, that's called the appendicular skeleton. And then the axial skeleton is the rest. Definitely when you have head, spine-related traumas, I think it's very, very important that those things get checked out. Now, does that mean that if you have hand trauma, that it's not that big of a deal? No, but at least it's not life-threatening. You know what I mean? You're not at risk of potentially dying within 48 hours if your hand's a little bit sore. But definitely if you're feeling stuff in the head, the spine, that's something that I think get checked out. Don't wait.
Short break, open lines for you. You have pain, you have questions about anything we've talked about, neck, back, headaches, bring it all on. 416-870-6400, star 640 on cell. It's the Dr. Payne Show, Global News Radio, 640 Toronto. 12:31, Dr. Payne Show. Lots of time for you to call in and talk to us. Just ignore our music. It's okay.
Yeah, this one.
It's like a Bon Tempe organ when I was a kid.
Jody's got to do something about this one.
It's a keyboard cat.
Totally. We're talking about injuries when they happen. Get on them because that time of year is coming up. Got Gordon on the line. Hey, Gordon, how are you?
Not bad, sir.
Good. What's going on with you?
Question for Dr. Lou here.
Sure.
Dr. Lou, it's not so much regarding a fall or...
no problem. Ask me whatever you got to ask me.
Okay, here we go. I've been diagnosed with something called Cauda equina.
Cauda equina, yep.
Equina.
Yep.
I've been told by my physician as of yesterday that it's quite serious. Mm-hmm. I'm now losing control of some of my movements here.
Yep.
And I've been told that surgery is absolutely necessary. And if I don't, I'm putting not only my mobility at risk, but also my life at risk. Can you kind of enlighten me on this?
What is that?
Yeah, so Cauda equina, so what happens is when you look, so I'll give everybody a lesson in neurology here. Mm-hmm. You've got the brain. Below the brain is the brain stem. Behind that is the cerebellum, whatever. Then we get into the spinal cord. The spinal cord is one piece of cord up until about L1, L2. At that point, it becomes a cauda equina. Cauda equina in Latin, I believe, means horsetail.
Yeah.
And because that's what it looks like. If we were to open up a person's spine, after L1, it just looks like a bunch of nerve fibers. It looks like a horse's tail. cauda equina syndrome is, for whatever reason, usually related to some type of serious disc protrusion where the jelly's spilling into the spinal canal is putting pressure on those nerves. Okay. The pressure on those nerves is now causing things like loss of bowel bladder function, usually saddle anesthesia in the crotch area, that you may start losing control of your limbs down there. It is 100% absolutely a medical emergency, Gordon. And you will, if it has been confirmed that you have cauda equina, I would automatically tell you, go ahead with that surgery, because that surgery could be the difference between having full function and potentially having no function and potentially being, yes, life-threatening. So not to scare you, but it sounds like they've caught it. And if they're suggesting surgery, you should go ahead with that, especially if it is there, because you will need it. Did you have like a disc herniation leading up to this? What was
yes,
yeah?
I did. I have spinal stenosis as a result of osteoarthritis and disc herniation.
Yeah.
I've also been told that the surgery, in layman's terms, is called spinal fusion, which I've heard from more than a surgeon and a GP as well, that the success rate is 80%.
Mm-hmm.
The remaining 20 can be anywhere from a minor infection along the spine, or right up to and including paralysis from that vertebrae down.
Yes, but and again, everything has its risks and its benefits. And I know 80% sounds like, oh, that's a big chance to take. That 20% might be bad, but the risk of you having all of those things if you don't do it is probably 80%. So. So you're in a position where you should definitely consider it. Again, I can't give you a specific recommendation and say yes or no, but just based on the sounds of this, it sounds like you're on the right track. I would continue to have very serious conversations with your family doctor and the surgeon, and if they're recommending it, just ask the right questions. But I believe if they're no professional wants to do spine surgery to somebody if they don't have to, and if they don't think that there's a much greater benefit than there is risk to it. So cauda equina is nothing to take lightly. I tell my patients that I see that have disc herniations that's always a potential cause or a potential thing that can happen. You might do something, you might move a wrong way, all of a sudden all that disc material starts to prolapse into the spinal canal, putting pressure on the cauda equina, leading to cauda equina syndrome. I always tell people that have disc herniation, spinal stenosis, if at any time you start the feeling that you've lost control of your bowel bladder, and that's whether you can't control it or whether you think you have to go and you can't go, and you start getting numbness, tingling in the genital areas, and your legs start to feel really, really funny, that's 911 right away. There's no time to just fool around.
Get on it.
Yeah, and say, oh, I'll wait till next week. No, it is what it is. Yeah.
80-20 is good. That's a good, that's,
I think better than the alternative.
If I said, buy a Lotto Max ticket, you got an 80% chance of winning $55 million. You're going to buy a ticket? Damn right, you're going to buy a ticket.
I'm going to buy more than
exactly.
more than one.
Doesn't sound too bad. Now, got Mike online. Hey, Mike, how are you, pal?
I'm well, thank you.
Good. What's going on?
Not much. My son was in a motor vehicle accident about 3 weeks ago this Monday.
Right.
And he's been suffering still concussion symptoms.
Mm-hmm.
He had nausea and dizziness. Now, those have subsided, but the actual headache is still there.
Right. How old's your son?
22.
22. And was he checked out after this?
He went to emergency, but they just really diagnosed it as concussion. Right
okay.
Off of the
Yeah.
bat.
No, that's good enough. That's what I mean. Like the ER doctors are going to be able to pick up if there's something more serious there. Now, the good thing is after 3 weeks, timelines also tell you a lot. Something like a brain hemorrhage progresses very, very quickly. So yeah, you're probably right, and the doctors are probably right that it is a concussion. But those concussions can stick around for a significant amount of time if you don't do the right things for them. So what has your son been doing in the meantime?
I've actually been sending him to this oxygen therapy place. For the life of me, I can't remember what it's called, but it's pressurized, and it's 100% medical grade oxygen that they pressurize this capsule that you're in.
Right.
It's something that I think Crosby went through.
Yeah.
But that's been out of my pocket.
Mm-hmm. Yeah, for sure.
And really, that's it. He's lost 3 weeks of work because it was work related, because it was during work hours. That's the other problem. Is it WSIB or is it motor vehicle accident?
That's going to be a question for Sivan. So again, you're going to be a good person. Sivan's going to do quite well. But I think in my experience, people that I've had patients that have had this scenario where there's a car accident, but while working, and they have the choice on whether they choose the car insurer or whether they choose WSIB, and you have to pick one or the other, and you can't go both ways. That I can tell you for sure. Most people, in my experience, end up picking the WSIB because they're worried about income replacement. But remember, there's ways to replace your income through the car insurer as well. So I think that's a question for Sivan and his team on what is the best option for your son. And I can't really comment on which one he should or should.
I realize that. That's one of the things we've been having around the coffee table for the longest time. The conversation is, is it WSIB, and in 10 years or 15 years, because they'll be around still, and the claim was made, then they can retreat it. If it's an insurance thing, it's sort of done and over with, I believe.
I don't know. Not necessarily, but again, that's not my area of expertise. What I can tell you, the main focus as well should be on trying to get your son better. If you're interested, I would say bring your son in. One of my colleagues, Dr. Adrian Rossi, does a lot of neuro rehabilitation with concussion patients. And I think he'd be a very, very good person to assess your son and determine if there's more things that can be done along with the things that he's potentially already doing that can help in his prognosis.
Okay. Thank you very much.
No problem. Take care.
And we'll take a short break. Phone lines are open. You have questions, conditions as well. 416-870-6400, star 640 on cell. It is the Dr. Payne Show. It's Global News Radio, 640 Toronto. 1242 up till 1 o'clock this afternoon. Dr. Payne Show, yeah. 416-870-6400, star 640 on cell is the number to call to get through, ask your questions. Headaches are always big this time of year. Temperature change. I went through, I can say personally, about 7 people in my family went through a migraine over a span of a week. It was like going through the whole house.
Yeah, headaches.
I think it was climate change or temperature change anyway, right?
Potentially, for sure, could just be related to, when we say temperature change, it's hard to determine what is it. One of my small theories is that as things get colder, our muscles tense up more. And so it's just not necessarily a headache being caused from the head, but by the muscles of the neck and the shoulders, work-related stuff. I think during this time of the year, people are also less active in general, just because when it's nice, you'll go out, you'll move around a little bit more. And again, that keeps the muscles nice and healthy versus when you're not doing those things, then things are going to tense up. But yeah, headaches are very common. I mean, headaches are common all the time, though. It's not like, only on December 8th do people get headaches, but there's something that people are always complaining about. We've talked about this, that, if this is a new headache, if you have a new headache today, those are often more serious not serious in the sense that they are serious, but you got to pay a little bit more attention as to what's potentially causing that, right? Because some very bad things like hemorrhaging, since we were talking about strokes, can cause headaches. Usually those types of things, people will characteristically describe the worst headache they've ever experienced in their whole life. That's how bad those headaches would be. And so if you ever at any point in your life start to experience a headache that feels like the worst headache you've ever had in your life, you need to get checked, because that could be stroke, could be hemorrhage. And also, again, depending on the other things of the case, like are you elderly or are you on certain medications? Do you have heart disease? Those things will tip you off towards, this is more likely or less likely, but that's a professional's job to determine that. Things like tumors can cause headaches as well. Those tend to get progressively worse as time goes on as well. But the vast majority, 99% of headaches are just simply related to mechanical things, the neck, the shoulders, and the muscles and the joints, and how they all interact based on posture and the different things we do day to day. And that's good that those are the vast majority, because those are also the ones that are going to be easiest to treat, right? Obviously, treating a tight muscle is much easier than treating a brain tumor. And so there's lots and lots of healthcare professionals, whether they're in my team or not, that can help with those things. So if you're a long-term sufferer of headaches, haven't had good results on trying to figure them out, give me a chance. Let me assess you. Let me see what I think it is, and see if we can't find something that can help you. Sometimes then you get into the migraine types of headaches.
I was
right?
just about like, how do you, when someone comes to you and you diagnose it as a migraine? I mean, there's maybe the physical thing you can do, and then we know there's pills out there that are like hundreds of dollars each.
Yeah.
Apparently they work, but they're big bucks.
They're big bucks. Yeah. Migraines are a little bit different because we're not really sure why migraines happen. The theory is it's more related to vascular flow to the brain. So that's not really like, can you push on a muscle and change that?
Right.
Maybe not. There is some research to suggest that doing different things to the neck can increase blood flow to the brain, and potentially that could help or worsen. Right. I know of cases of people who thought, okay, I'm going to get some treatment on my neck as well, but it causes a flare up of their migraine.
Really?
Yeah, it's also possible. So migraines are a little bit different. In my experience, I think that a combination, right, like everything that I always say is trying to use a little bit of everything at your disposal is probably best. Like if you can use the medications, you can have a good, healthy lifestyle, exercise the right way, and also get some therapy. That's probably the best approach. Migraines, once somebody has a migraine, migraines often come along with other signs and symptoms where people will say, I get blurry vision or
sparkles or something.
Or I hear weird noises. Obviously, if this is the first time you're experiencing that, you have to rule out other potential causes of that first, because again, brain tumor, strokes, any type of neurological disorder could potentially cause those things. So in a way, a migraine is almost a diagnosis of exclusion on once a healthcare professional has ruled out those more serious things that can present the same way, then you can kind of say this is a migraine that's causing those things. And then, yeah, you're right. There are some very good medications out there for migraines, but like anything, the issue with interventions is as you do them,
right,
they start to work less and less because your body adapts, right? And that's just the reality of, you can talk to people that have never taken an Advil before, and then all of a sudden they have something, they take an Advil and they say, wow, that is amazing. I've never felt.
Yeah, it's like drinking your first beer.
Yeah, exactly. And then, by the time a year later you're talking to them about Advil, it's like, yeah, it does nothing for me. Or I now need to take them every 3 or 4 hours in order to have an effect. The same is true for physical interventions as well, right? We all know that if I'm very, very unhealthy and I start walking 20 minutes every day, I'm going to have a certain advantage to that, and I'm going to get a little bit healthier. But at a certain point, I need to change that because my body will adapt. Same thing happens with physical therapies, right? People that go get massage consistently, the first massage will say, wow, I feel amazing, like I've never felt so good. And then by the time they've done it for a few months, it's like, it helps, but it's not helping as much. I find
lackluster compared to the first time. Right?
Yeah, and a lot of people will blame that on the therapist. They'll be like, I don't think that therapist is that good anymore, and they'll try somebody else, and they'll be like, oh, I feel so much better. All that really is that you've broken adaptation. You have someone else that's doing the massage in a different way. And anyone that's a very, very good practitioner will know that their interventions are potentially going to be adaptable to that person and will have less and less of an effect. That's why when I have me and my team, when we intervene, I always talk to people about this, about dose and response. We don't want to get someone used to the things we're doing, especially if they're working really well, because that's a good tool for us to have in our pocket should these things continue to present themselves. At that point, we can then use that intervention when we absolutely
So
need.
you'll change it up if you have to?
Absolutely.
Just so they'll get used to it in a sense?
Absolutely, right? Yeah. It's very, very important to change the interventions and do the things that you're doing in different ways, and not get people used to it. That's why I like to... let's say something like back pain, right? And I've recommended someone to see one of our chiropractors. They're going to get, I like for them to get a heavy dosage of treatment within the first 2 or 3 weeks, and then start to wean them away from it. And then within, 4 or 5 weeks, they're not getting any more treatment. And then they're coming back when they need in terms of that treatment. But they may still be coming back after 5 weeks because now we're working on rehabilitation with them instead of just doing manipulation and modalities and things like that. So it's very, very important in healthcare that you avoid adaptation, and it can happen with anything, whether it's a pill or a physical intervention.
And a lot of the physical stuff would have a certain amount of homework involved, meaning it's good to go to physio 1 hour a day, but the other 23 hours, 6 days a week.
You got to do. You
kind of got to do something.
Yeah,
right?
For sure. And that's a different discussion in terms of when people say, "Well, I don't really get better. I'm going to the therapy, but it's not making a difference." A lot of people are relying that the therapy for that 1 hour is what is supposed to make them better. But that's really maybe designed to get, depending on the case, right? We're speaking generally here, but maybe that therapy session is designed to get things going, and then you've got to do the right thing. So, the example is if you've got neck pain because of your posture at work, and for whatever reason in the last week it's really exacerbated, you go get some therapy on it. It feels great after the therapy, but then you're going back to work and you're not modifying your posture. Well, of course your neck pain is going to come back. Like, let's just be realistic about that. That would be the same as if you had a really bad cut and you decided to go get stitches at the walk-in clinic or urgent care clinic, and then you went out and later that day you ripped the stitches open. Of course you're going to bleed again, right? So that's the important thing about once an intervention is done, there's going to have to be things that you're often recommended that you should be doing for the rest of the day or the next few days until you come back, because that's what's going to hold the effect.
416-870-6400, star 640 on cell. Lots of time to call Dr. Payne, ask about your questions, your problems you're having. Bring them on. We'd love to talk to you right till 1 o'clock this afternoon. Dr. Payne Show, Global News Radio, 640 Toronto. It's 12:53, a few minutes to go. You want to call through, 416-870-6400, star 640 on cell. Free assessments, rather. Details.
Yeah, the consultation. Yeah, I was just going to say that don't think that you can only call me between 12 and 1 on Saturdays. You can call me anytime. I had someone call yesterday. They left me a message and I called them back, I think after 20 minutes, and they were like, wow, that was fast. And it's me that personally calls you back. So you just want to discuss what's going on. Just call, hit 2, which will it'll give you the option to leave me a voicemail. Leave me your name, your phone number. Very, very quick description. Some people will go on for, minutes and minutes telling me their issue. I'm not going to listen to the whole thing. I'd rather talk to somebody.
For sure.
But, if you're having back pain, instead of giving me the whole history of your back pain, just tell me I'm calling you with regards to my back pain. That's all I need to know in that phone call. Then I'm going to call you and I'm going to say, tell me what's going on. Because for you to just rant it off in the message doesn't do it justice, because then I like to interrupt and ask some questions that gives me a little bit more information. We can have a quick discussion. Usually it's 5 to 10 minutes. And from that discussion, I can figure out what's the next step. Is it do you need an assessment by me? Should you continue seeing your family doctor and maybe just ask these questions? Are you already seeing the right people, or are you completely on the wrong track? A lot of people are coming in to see me second opinions, right? They've been told something is wrong. They're doing something for it.
Yep.
They're not necessarily 100% confident, and they just want that second opinion. Happy to do that. That's perfectly fine. Give me a call, 1-855-55-DRLOU. That's as simple as it is. Or call me or email me at info@paincarecanada.com, or just go to Google, type in Pain Care Canada, and from there you'll find the website and all the information is there. And yeah, if you've got questions, concerns, whatever it may be, I'm happy to take your emails, your calls. That's
cool.
What I'm here for.
Alyssa, hello there.
Yes, hello.
What's going on?
I've been diagnosed with vertigo.
Okay.
Back in August.
Mm-hmm.
And so far it's, nothing really helps. It doesn't change.
Right.
I never feel really, really bad.
Mm-hmm.
Like some people say, oh, you wake up and everything turning around. I said, I never feel that way.
Right.
I just woke up. I came home from work, and I feel dizzy, and I continue to be dizzy.
So then let's start with something. Does it feel like you're spinning around the room, or the room is spinning around you?
It's more like unstable.
Unstable. Okay, so
yeah.
All right. And you said you were diagnosed with vertigo. Who diagnosed you with that?
It was in the hospital.
Okay. What did they do in the hospital? Did they take any imaging of your brain, anything like that?
They did CT scan.
Of the brain?
Yeah.
And it came back normal?
That's right.
Okay. Yeah, I mean, I don't know that just based on a CT scan you can confidently say, again, vertigo is like saying fever, right? It's exactly. Like, okay, but what's causing the vertigo? Sometimes vertigo can be caused due to a neck issue. Sometimes it could be caused due to a problem with the crystals in the inner ear, which is very common. Sometimes it could be due to more serious things. That's why they would have taken a scan of the brain. So there's a bunch of different things that can cause vertigo. And if you don't know the right thing or what exactly is causing the vertigo, it's going to be very hard to treat, because you're going to treat the inner ear differently than you're going to treat the neck, different than you would treat, say, something like a brain tumor, which you don't have because you had a CT scan. So I think the problem that I'm hearing from you is no one has actually gotten to the bottom of what is causing the vertigo.
That's right.
Yeah, and if you can get to the bottom of what's causing the vertigo, then you can have the very specific treatment interventions, and those treatment interventions will be more likely to work. So the best option is give me a call. You're a good option for an assessment. We'll set up an assessment and we'll take a look at it and see if we can find anything.
Oh, that sounds great.
Okay.
Thanks, Alyssa. Appreciate that. 1-855-55 Dr. Lou, DRLOU is the number. And psychosocial can also cause that as well. Stress, anxiety.
Absolutely. It could just be stress.
Sure.
It could be a virus. Some viruses are really nasty and can cause people to feel unstable. There's so many different things that can cause it. But this is very, very common where people are told that they have what I like to call a clinical sign, because that's what that is. It's more of a clinical sign. And they're told, oh, yeah, you've got sciatica, or you've got vertigo, or you've got this, or you got that. If you don't know the underlying cause, how can you possibly be sure about how you treat it? Right? It just, to me, it doesn't make any sense. I think you have to continue that investigative process and get to the bottom line. Once you get to the bottom line, then all of a sudden your treatment options are going to make a lot more sense. And then if your treatment options aren't working that's when you maybe have to consider, am I wrong? Is it a different diagnosis? Or, sometimes there's some things that just can't be helped for whatever reason. But in my experience, if you get the first step is having the right diagnosis. If you figure out the right diagnosis, there's a better likelihood that whatever the treatment intervention is going to work, because you're going to tailor it specific to that diagnosis.
It just takes a bit of time. You got to work through it, right?
Yeah, it takes a little bit of time, and people will often just, I also think it's kind of the fault of the healthcare professional, right? If I see someone like this, I would say to them, hey, if I was the emergency room doctor, I would have personally said, hey, we've done a CT scan. You don't have anything in your brain that's malignant or potentially very serious, but you do still have these symptoms that are consistent with vertigo, but we need to figure out what's causing the vertigo. Right. That's not my job in an emergency room. My job was to make sure that this isn't an emergency. Yeah, not a stroke, not anything. But please follow up with your family doctor or your other healthcare professional that you see, and make sure that you get investigated onto what's causing the vertigo. That way you can get it treated properly. And that doesn't take very long to say. The unfortunate reality is that most professionals don't say that.
And a good way to wrap it up for today, moving forward, 1-855-55 Dr. Lou, DRLOU. To get a hold of Dr. Lou, info@paincarecanada.com as well. Till next time, Dr. Pain Show, Global News Radio, 640 Toronto.